I'm having a little Britney Spears moment to wrap up.
Yeah.
Exactly.
Always.
Gotta keep it light.
Today is November 3rd. It's a Wednesday, so we're halfway through the week. Happy hump day. This morning's been a good morning. It's been a little bit slower, but it's been nice to take some time, spend a little bit of extra time on cases, as well as spend some time mentoring. So Mel was doing a mastectomy this morning. This bitch had a couple lumps in her breasts or her mammary tissue.
Carly's gonna help me just because I haven't done it before, but I think it'll be fairly straightforward. She's got 2 masses in her mammary chain. So just like humans, dogs can get breast cancer too. She's got one right here. That one feels more like a pea. This one is more irregularly shaped. It's more shaped kind of like an almond, but it's a lot softer. So after discussion with the owner, we're just gonna take both out. We're gonna try to get as big margins as we can, and then we're gonna send them to the lab and they'll let us know what they actually are and whether we got complete margins or not. If we didn't, the owner knows we might have to go back in and do a second surgery.
So that's what I would do, try to remove as much of the mammary gland as you can.
Okay. Looks so much easier in the textbook. I'm just more wondering when the large blood vessel is gonna make an appearance. But also in the textbook, looks like it should be fairly obvious. Oh, I found it. I'm just going around and basically dissecting all the stuff away from it, but because I don't know like where it goes to, you take margins that are at least 1 centimeter in every direction. So you end up taking out like a whole bunch of tissue, and then that's when you send that whole thing to the lab and you find out, did you get it all, yes or no? Carly's here if anything happens.
You got it though. The worst that'll happen is it'll bleed. And then we'll find it. and
then we'll fix it.
In Pinoca, I had a really good associate female vet who was an amazing mentor. She very much was like that, was always very calm and collective. So I feel like I gained some of my mentorship skills from her in terms of nothing is a huge deal. Everything can be fixed. I'm very grateful for that mentorship that I had, but it definitely helps me mentor Mel.
This is why the textbook is and is not helpful, because everything in the textbook looks so pretty and laid out and you think everything's going to be so obvious, and then you go into the real world and it just looks like a giant pile of mush.
Like life.
Yeah.
I think there's a nerve there, so be careful.
I think so too. Right there. Yeah. Yay! We get to do it all over again.
Proud of you.
Yay! Hopefully it'll be a little bit faster now that I kind of know what to expect. So one of our screening tools is going to be chest x-rays. It's definitely not perfect. Ideally we would do like a full CT scan, but we don't have that in general practice and it's really expensive. So, because cancer doesn't always like to stay in one spot, right? So that is part of the challenge, is figuring out like what is going on and where is it. Instead of me singing Britney Spears in my head.
Sing away now.
Actually, the owner brought her in to talk about her teeth, so she is gonna get a dental. We're just gonna deal with her lumps first, just because figured this is probably a little more urgent / time limiting. Like if she's got really bad mammary cancer, she might not want to spend all that money on a dental for her. But if we get it back and we find out, hey, this isn't actually cancer, it's just a benign growth, or yeah, it was cancerous, but hey, we got complete margins, then she may want to go ahead with the dental. You know, like I wouldn't do this procedure and a dental just because there's a lot of bacteria that get released with a dental. They're really dirty and we want to minimize the chance of, you know, any type of infection. We are done! Yay!
So Mel did an amazing job with the mastectomy. She was able to remove the glands without a significant bleeding.
Just had surgery like 10 minutes ago. No big deal. Sophie, the 6-year-old German Shepherd that came in today, presented to us with an ocular lesion of her left eye. Upon closer exam, you can obviously see that there's a significant amount of redness in the eye. It does appear a little bit irritated, but not as irritated as you'd expect for what it looks like. So I'm just worried about lots of different diseases in the eye. German Shepherds get pannus, which is an autoimmune disease of the eye, so I'm a little bit worried about that, but I'm also worried about like corneal ulcers. But it does look like it's in actually both eyes.
Oh, you can see it starting there, hey?
Yeah. That looks like pannus. And I'd worry that this started like that, and you can see like on the side of the eye how it like kind of infiltrating in.
Can she see it on the side?
I think she can see, but I don't think well. He said that she's been like barking more and stuff. She can see this way, but not.
Yep.
From the side.
We then secondarily stained the eye with some fluorescein stain. The fluorescein stain attaches to any lesions on the eye, so if there's underlying cornea that's exposed, it'll attach and stain that. But that we didn't see any signs of corneal ulceration.
You're being really good. You're never gonna want to come back here.
I can't put eye drops in my own eyes. I joke around and I said if I were to ever be a dog, I'd be a German Shepherd just because they're of all their ailments.
And then finally we froze the eye and then checked the pressures. Both eyes were completely normal.
Let's try the good eye first, maybe, just because maybe she'll realize it doesn't hurt. Oh. Okay. Good girl.
Based on the breed, her age, and what the eye looks like, and considering we're starting to see it in the other eye as well, I'm most suspicious of it being pannus. Now, pannus is something that we see most commonly in German Shepherds. It is an autoimmune disease of the eye that can actually be triggered by UV light, so something that we really can't avoid. Dogs being outside, being exposed to the sun. Essentially, the body attaches the MHC complexes or the antigens in the eye that are normal body antigens and then cause this severe clouding and inability to see out of that eye. As it progresses, you can see it goes completely across the cornea. The other eye is starting to be affected, but it will cause blindness eventually. So the hope is with steroid and immunosuppression use topically in those eyes, we can halt it from getting worse and maybe even reverse some of it. That left eye will still probably have some pretty significant scarring, but hopefully we can save some of the vision in the eye. So right now I started the dog on dexamethasone drops every 6 to 8 hours for the next 21 days. Then we'll reassess to see if we can start dropping that dose down. I also started on tacrolimus drops every 12 hours, possibly long term. So in cases that don't respond to topical treatment, then there is some surgical options. That is something that would need to be done at a referral center with an ophthalmologist though. We'll check back with her in a few weeks and hopefully we see some significant improvement.